All right, this is Jesse Lloyd, and this is chapter 13. This week's topic was personality, and the four different parts that I wanted to present or explain. The first part is the personality theories. This this begins with the cycle analytic, where it deals with emotional disorders, the internal conflicts, and the defense of anxiety. The second personality theory is the psychodynamic, where it consists of unconscious and conscious, where the conscious and unconscious mind communicates. Childhood experiences, and then there's the importance on the defense mechanism. Uh, the third, when it comes to personality theories, is the humanistic, where it focuses on ways where people can be healthy um, and striving through self realization. Um, so, after that is the traits, where it's stable and enduring characteristics, and this also the trait involves the genetic predispositions. And lastly, when it comes to personality theories, are the social cognitive, where it involves the traits, interaction with the social contact or aspect of it, and to produce our behaviors. So, our experiences is what helps shapes our personalities. Um, the the second part is the six defense mechanisms, and that begins with the displacement, which we it involves shifting the frustration towards an entire different object or being or situation. Um, Secondly, is the denial, where you're refusing to believe or accept the pain. We can cover it, we can mask it, um, being what the situation calls for. Um, and the defense mechanism, it goes on with regression, where the patient will find that they revert back or go back to earlier psychological stages, where and the psychic energy remains fixed. After that is the reaction formation, where is inacceptable impulses into their opposites. Um, Projection is where we are able to identify those things that we um, are dealing with, or rather refuse to deal with, that we see and project it onto others that may project those characteristics. After that, it's the rationalizations, and that involves self justification. So we justify it so that we don't deal with it. We justify it so that it it allows the patient to continue to do what it is they do. Um, all right, the third bracket will be the psychosexual stages, um, where it begins with the oral. That takes place from 0 to 18 months, and the oral consists of pleasure focused on the mouth, which includes biting, sucking, or chewing. Secondly, when it comes to the sexual stages, is the anal, which involves the bowel, the bladder, the elimination, coping with the demands for control. The third, when it comes to psychosexual, is the phallic, and that occurs from 3 years of age to six, and that includes the pleasure and genital and ancestral sexual ancestral feelings. If I can back up to the anal um, phase, that goes on from age 18 months to 36 months. Um, the latency phase takes place from 6 years old to puberty, and that consists of the phase of the dormant sexual feelings. After that comes the genital, um, where it takes place from puberty on, and that's the maturation of sexual interests. And lastly, when it comes to the different brackets, it's the big five personality factors, and that begins with the consciousness, organized, careful, and disciplined. The agreeableness, the soft-hearted, trusting, and helpful. The neuroticism is the emotional stability versus the instability. You're calm, secure, and self-satisfied. Openness is practical, prefers routine and conforming. And lastly, it's the extroversion, where you are social, fun, and loving and affectionate.